One of the biggest challenges that we see is acne scars. And I know it's a very difficult problem because usually it's a tough phase of your life. You've gone through usually during your teenage years. And so there's a psychological part associated with this in addition to the physical part, which reminds everyone of what they had to undergo with the acne scarring. I think the other part is that people have tried many different modalities and they haven't really seen a huge response. So that tends to be deflating when you think about, do I really want to try something else? So what we've done is over the past decade, we've actually accumulated 4 different technologies, each of which have been very effective and have been well known in the scientific literature to work for acne scars, and combine them into one. We call that Lasercision. So the idea is that as one step, if you think about an acne scar, is essentially tethering of the skin that has lost its elasticity and collagen. So the first step is to go in and release that scar, the tethering underneath the skin. And then the next level is to go in and actually help buffer it so that the skin doesn't scar back down. So that layer of buffering is either done with an injectable or when you use your own tissue, such as fat or skin, to put that underneath the scar so it doesn't stick back down. And then the third part is that because that skin around it has been atrophied or has lost its elasticity, we want to build that up again. So we put material that helps stimulate the collagen over a period of about 6 weeks. And finally, last but not least, the fourth part is the laser that's used for resurfacing. So if you can imagine, you have potholes on the street. First, you need to come in and fill the potholes. And then the last step is to use a steamroller to smooth the surface of that road. And this is no different with the skin. Our view is that the last step needs to be a resurfacing. And why I like to use lasers is because it's very specific. The technology is very specific to the depth of what you want to do. And I think having used these 4 modalities as one in a technique that we call Lasercision has been extremely helpful with patients with this difficult problem.